Doctors are sounding the alarm about a tumor that can affect the uterus without any symptoms. A hysteromyoma is a fibroid tumor in the uterus. It can be dangerous, although 90% of cases are benign. Triathlete Fei Yu-fan was one of the patients who developed the tumor with almost no symptoms.
She finally realized she needed treatment after finding a lump in her abdomen through self-massage. Doctors say that 30% of women in Taiwan aged between 40 and 50 have hysteromyoma. For people in that high-risk group, they recommend regular checkups.
As a triathlete, Fei Yu-fan is a picture of health and vitality. But 2 years ago, she was surprised by an unexpected discovery.
I never really had any symptoms, just sometimes I would think my belly seemed to be getting bigger and bigger, and I was peeing a bit more often than normal. All along, I thought my abs were too tight, so I would just lie in bed and rub them. And as I was pushing my belly a bit, I found a hard lump.
Fei realized she had a lump while she was massaging herself. Medical tests revealed it was a hysteromyoma, a tumor in the uterus. It was already 15 centimeters wide and had pressed her uterus into an L shape. Her vertebrae had also been displaced, but with high-intensity focused ultrasound treatment, the tumor was removed and she made a good recovery.
I
didn't want to have a treatment that would leave scars and adhesions. I looked up Dr. Fu's clinic, and actually it wasn't too painful at all throughout the whole process. The recovery was extremely fast. The day of the surgery, I got out of bed and I wanted to go and eat out, but they stopped me. The treatment uses temperature to destroy the blood vessels around the tumor and the tissues of the tumor. After that, the blood supply is reduced and the tumor gradually withers away.
Statistics show that 30% of women in Taiwan aged 40 to 50 have a hysteromyoma. The incidence of the condition among younger women is rising.
The condition is getting more common among younger people, perhaps because our diets are becoming more refined, or we are trending towards more Western-style diets, higher and higher in fat and calories.
When hysteromyoma causes more obvious symptoms, patients notice menstrual pain, an increase in menstrual blood, needing to visit the toilet more often, and constipation. But in a few cases, the tumor has little to no symptoms at all, which is why doctors recommend regular checkups.